Okay, so right now we are putting a doc on the clock this year on a Wednesday.
Yeah, our topic today, why the benefits of a flu vaccine far outweigh the risks.
Okay, so joining us right now, Dr. Robyn Strosaker. And doctor, thank you very much for taking the time with us here.
Now, doctor, the flu season is arriving a little earlier than normal this year. When should people actually get their flu vaccine?
People should get their flu vaccines as soon as it's available. So I know in northeastern Ohio, it's been available for a good 6 to 8 weeks. So if you haven't gotten your flu vaccine, now is the time to do it.
Okay, well, I already got mine, so I'm in pretty good shape. I'm feeling good about that, right?
Good.
Why is it so important right now to actually get vaccinated? It's just the flu. Everybody gets over it, right? How does it affect people differently?
Well, you know, people think, oh, it's no big deal. I might not feel well for a couple of days, but there's actually lots of people who are at risk for pretty severe complications of the flu. You know, and those tend to be young children under the age of 2, adults over the age of 65, anyone with any other conditions, heart conditions, you know, diabetes, kidney disease, people who are immunocompromised. So I always like to think of it that even if you don't fall into one of those categories, you're probably going to be around people who do. So you're not only protecting yourself, but you're protecting those around you as well.
Well, we hear a lot about the danger of the flu vaccine for pregnant mothers, for instance. Is there any merit to the latest studies that try to make a link to the flu vaccine and pregnancy?
I don't believe so. I've read them at length. And there's one study that showed a potential association, but there are overwhelming numbers of show that association. What we do know is we know that if we talk about populations who are at risk from the flu virus, we know that pregnant women, women in the immediate postpartum period, and infants tend to be people who can be very severely affected if they get the flu virus. So especially for those populations, we know that the vaccine, the benefit of the vaccine greatly outweighs any risk.
Okay, and this is the big one, the classic that we get every year. If I get a flu shot, I'm going to end up with the flu. Not true, right?
Not true. So in the flu vaccine, there are inactivated pieces and parts of the virus. So it's not a live virus vaccine. There's nothing in the vaccine that could actually give you the flu. Now, you could have a little bit of a sore arm. Maybe you might not feel great for a day or two, but it's not the flu.
Don't I know it?
Very good.
Are you impressed? I got my flu shot
Yeah,
this
I'm
year.
very proud of you. We're all very happy about that.
All right, doctor, I'm afraid of needles, but I did it anyway.
Well, we're not afraid of you. Thanks for being our doc on the clock. We appreciate it. Thank you.